Welcome to our World Ostomy Day Voices webinar presented to you by Embracing Ostomy Life. And I am Dr. Carmen Fong, but I am really just here as a moderator for you guys to hear a bunch of wonderful stories from both patients and caregivers. I'm going to introduce them really briefly so I don't take up a ton of your time. And then afterwards, our guests are going to share their stories, and we will have some time for a Q&A at the end. If you have any questions and you're in the live audience today, absolutely drop them in the chat and I will pull them out at the end for our speakers and ask them. And if not, I have some questions of my own. And we should really be done, probably by, I would say, like 45, 50 minutes to the hour, with time for questions at the end. So without further ado, this is World Ostomy Day Voices, sharing patient and caregiver journeys. Our first guest is Mr. Rolf Benirschke. He's a former NFL place kicker whose 10-year career was nearly derailed during his third season by a life-threatening battle with ulcerative colitis that led to ostomy surgery. After a remarkable comeback, he returned to play 7 more seasons with the San Diego Chargers. With a passion to improve the lives of ostomy patients, he founded this nonprofit, Embracing Ostomy Life, to support and encourage everyone who undergoes this life-changing surgery. So welcome, Mr. Benirschke. Oh, we have someone else in the audience.
Thank you, Carmen. Thank you. First of all, it's a thrill to be here talking about a very tender subject that is very personal to those of us on this call. You've asked me to share my story, so it goes back in time. I'm 70 now, so this goes all the way back to when I was 23 and diagnosed with ulcerative colitis, Crohn's disease initially, ultimately potentially ulcerative colitis. We're still not exactly sure. But actually, let's go back a little before that. So I was actually raised in an academic medical family. My dad was a medical school teacher at Dartmouth, and he was recruited to help start the medical school here in San Diego. So we moved out here when I was 15. Total shock to our family. Totally different culture from New England to Southern California. Didn't know a soul. But like a lot of really difficult things in life, and that was difficult. I mean, we had just won the states in hockey in my middle 9th grade Bantam team. I thought we'd hang together the rest of our high school, and that wasn't to be. Dad moved us, and it was awful. And it was one of the greatest things ultimately in our lives. We didn't see it at the time. And that's kind of a theme that I've learned. I am arguably the most grateful patient you'll ever meet. So fast forward, we moved to San Diego, and it's only because of that I end up playing football. I get talked into kicking football my senior year in high school. It gives me an opportunity to go to college. My dad thinks I'm crazy. Do something worthwhile with your life. Short stories, I get drafted to play football in the NFL. My dad is just, what? Drafted? I thought the war was over. What do you mean drafted? Dad, they actually have an NFL draft. I was the last player drafted, ended up on the San Diego Chargers, our home team, back when we had a team in San Diego, and our team was actually really good. We didn't appreciate it at the time. Again, like a lot of things in life, when you're in the middle of it, you don't quite have a perspective to realize, in our case, that our coach was extraordinary. He was changing offensive football, that the guys that were my teammates, they were just my buddies, would end up in the Hall of Fame, a bunch of them. And we were setting all kinds of scoring records and changing offensive football. And as a kicker, I was busy and I was making a difference. And I'm suddenly enjoying this dream I never had. And this whole new world is opening up for me. Had success my rookie season, start my second season, and I come down with what I thought was the flu. Well, my flu persisted, and it turned out it wasn't the flu. It was diagnosed as Crohn's disease. But in the NFL, you're either the starting kicker or you're unemployed. And I was having fun. The team was beloved by the city. I was making a difference. We're scoring a lot. My illness persisted. But I needed to keep playing for my teammates, and because I wanted to. But by the end of the season, I was losing weight, losing strength. Fortunately, kicking is more technique than anything else. The last month of the season, I was literally playing the game on Sunday. Sunday night, they put me in the hospital, put a central IV down my neck. I kind of be fed all week through IV. Couldn't really eat much. Would have the IV pulled on Saturday night, spend the night with the team. Saturday night, play the game on Sunday. Sunday night, back in the hospital. And so for a month, that's how I got to the end of the season. At the time, this was 1978. We didn't know a lot about inflammatory bowel disease. There were very few treatments, none like we have today. But I tried everything, the traditional, and then that off season, the non-traditional. I did acupuncture, biofeedback, changed my diet, did everything. Convinced myself I was getting better. Started my third season. We're now preseason picks to go deep in the playoffs. I remember, this is a thrill, but I'm still in pain. We open the season. I kicked 4 field goals. We win the game. We're in the locker room afterwards. Everybody's celebrating, and I'm in front of my locker crying. The pain is so bad. It's like somebody has a knife in my abdomen and they're turning it every time I move. I don't know what to do. Well, the decision was made for me. 3 games later, flying home from a game of cross country, collapsed on the team plane, um, passed out. Players kind of got me back, wet compresses. They landed the plane. My dad met me at the airport and took me to the hospital where I needed surgery, emergency surgery. Um, my colon had started to perforate. So they took out part of my colon. Now, they should have, I would say Dr. Kleiman would agree, they should have given me an ileostomy right then. But the poor physician, the colorectal surgeon, in his mind, I know, and I heard from him later, knew that if he gave me an ileostomy, my career would be over. He knew it, and he didn't want to make that decision. So he did a resection, sewed the end of the intestine together, and unfortunately, yet that anastomosis broke down. 5 days later, I had a second surgery, and I woke up from that surgery in the same hospital where my dad was a practicing physician, 65 pounds below my playing weight, with 2 ostomies on my side, septic, dying. And my doctor's telling my dad, I don't think Rolf's going to survive the night. The truth is, I had a near death experience with the Lord. And I survived that night, and then the next night, and the next night. And I would spend 6 weeks in the ICU and a total of 2 months in the hospital, eventually released to the care of my parents, where I looked around and go, why did I live? I can't imagine doing anything that I like. I'm wearing 2 ostomy bags. Lord, take my life. I'm ready to go. And I didn't die. And now I had to learn to live with an ileostomy and a mucus fistuloctomy. I was discouraged, depressed. Nobody talked about this. Fortunately, I had great medical care. I had great ostomy nurses that helped me. But I was in my mind, as I lay there, I go, there's nothing I like. I love sports of all kind. I'm thinking I'll never do that again. I'm making my living as a professional athlete. I'm going, surely that's over. And I'm 24 and I like girls. And I'm going, look, that's got to be over too. Lord, take my life. And he didn't. So now I had to learn to live with this. And this is where I appreciate the chance to speak to all of you that are either facing an ostomy or about ostomy surgery, and tell you that, like playing, you don't have a perspective when you're going through something. When I look back now over all these years, my ileostomy gave me a chance to do everything that I loved. Every sport that I played before I play again, including scuba diving, ice hockey, tennis, golf, skiing, and I returned to playing the NFL. I played for 7 more seasons, and I got married to the most beautiful girl in the world, and I feel like the most grateful. And it gave me an opportunity to have a purpose in life that I never could have imagined, and that purpose was to encourage other patients. So we built a program called Great Comebacks. What I learned was that this was not talked about in the public. There was no social media back then. Nobody wanted to talk about poop in a bag. That was just off limits. So every patient that had surgery went through by themselves. That wasn't right. And I'm sitting here looking around. So when I returned to play that first season back, when we would play in different cities, the local sports writer would often come out and write an article about me or send a TV crew. And wherever those articles appeared, patients would read them. And a lot of them would screw up enough courage to write me. So I'd come back to the locker room the next week and there'd be 50 letters in my locker. They were kind of all the same. Rolf Benirschke, completely misspelled, simply San Diego Chargers. And they'd end up in my locker. And the letters were all the same. Dear Rolf, how can you play football? I'm trying to. And it was like a fill in the blank. Go to school, go to work, be a dad. I remember thinking, oh my gosh, I had those same questions. But there was nobody out there talking about it. So anyway, short story, created a program to tell stories, to break up this restrictive lifestyle box we all think we're going to have to live in. can't travel, can't play sports, can't swim, can't have a family. None of that's true, but nobody was talking about it. So we started to tell stories. Back then, I wrote books. We did article published art. Now it's social media. It was awesome. But back then, it was we wrote stories about police officers and firefighters that returned to the force, triathletes, mountain climbers, guy that climbed the seven summits, tallest mountain in each continent, with an ostomy bag. President Bush's brother, Tip O'Neill, Al Geiberger, professional golfer. We blew up this box. Said, wait a minute, you can do anything, and I mean literally anything. I ran that program for 32 years. The stories were so incredibly inspiring. And that's the way it is today. The benefit we have today is social media. People are not afraid to talk about it. And it's a blessing because everybody that goes through this surgery has the same fear. And what we're here to do is to dispel that fear, to, again, perspective. I wouldn't trade, this is sound crazy, I wouldn't trade what I have been through, and it's been brutal. 4 major abdominal surgeries, septic, thought I was going to lose my career, everything else, for how it's changed me. I learned, and I've heard this from hundreds and hundreds of other ostomates, that it changed us. We learned that we had greater courage, greater ability to persevere, became more grateful, lived life differently, appreciated our families in a way we couldn't have because of not having gone through this experience. So my encouragement to you as you listen to this, I know it's frightening. If you're facing surgery, I know it's daunting when you have it. It's a challenge. It changes our lives. We have to think differently, but I wouldn't trade it. And I hope one day, if you're in a similar situation, you get to that place as well, where we become grateful. So grateful. Thank you, Carmen, for letting me share my story.
No, of course. Thank you so much. And every time I hear that story, I am completely re-inspired all over again. And
Mm,
I don't have an ostomy, but I don't do any of those things, scuba dive or play ice hockey or skydive. I remember when I was a resident, I had an attending who told me we had a patient coming in after an APR with a permanent colostomy and was a professional equestrian, so horseback riding. And back then, like, 5, 6, 10 years ago, I was like, what is this? But now, after meeting people like you, meeting people through Embracing Ostomy Life and all the other organizations, like that having an ostomy is not, the defining characteristic, is not your defining characteristic. There's just so much more that can be done.
it is remarkable. First of all, I think the courage of people get, you discover this that you have. You reminded me as I was thinking that I ended up writing several books, which were compilation stories of patients, 10 or 12 pages each story. And then we would make sure to give them to ostomy nurses so they could pass them to their patients who were all lying there looking at the ceiling going, I'd rather die than wear a bag. I mean, if I've heard that once, I've heard it 1,000 times. But those stories were just remarkable. Like you reminded me, there was a bull rider. This was a
Mm,
young kid that was a bull rider, gets an ileostomy, and he goes back and he gets a bull riding scholarship to, I don't know, Kansas or Nebraska,
yeah.
one of those schools. And it just shows there are no limits to what you can do.
That is amazing. I did want to mention that I have read Alive and Kicking, the book that Rolf wrote from cover to cover, and it's amazing and inspiring. And I definitely recommend it to my patients now who are like, I would rather die than have an ostomy. No, you wouldn't. All right.
No, you wouldn't.
Thank you
No.
so much.
Thanks,
I
Carmen.
don't see any obvious audience questions, but I'm going to circle back to questions at the end. And then next, we're going to have Dr. Michael Kleiman share his story. Dr. Michael Kleiman, here's a brief introduction, is an oral and maxillofacial surgeon from Edison, New Jersey. During his career, that was spanning more than 40 years as a private practice surgeon, he cared for hundreds of thousands of patients while also making major contributions on a volunteer basis at JFK Medical Center, where he served as both the president of the medical and dental staff, as well as chair of the board of trustees. He was also active nationally with the American Association of Oral and Maxillofacial Surgeons, where he chaired several committees and is still a delegate for New Jersey. In 2021, a series of unexpected health issues led to the loss of vision in one eye, followed soon after by a colon perforation. I'm going to skip this next part because I'm going to let Dr. Kleiman share the story. Um, Right now, although he is no longer able to perform surgery due to his vision, he remains active in the New Jersey healthcare community. Dr. Kleiman has two grown sons who both live outside of Boston, Massachusetts, and ironically, his younger son, David, the other Dr. Kleiman who is here with us today, is a colon and rectal surgeon and has provided unique and valuable perspective as both a family member and professional as has adjusted to his life with a colostomy. All right, Dr. Kleiman, you've got the floor.
Hi, everybody. Can you hear me? Okay, super. Yeah, it is ironic that my son ended up being a colon and rectal surgeon. Who knows, but it helped a lot along the way. So I finished my training in 1981 and I entered the world of practice in July of 1981. And I had a very active career in both office-based and hospital-based surgery. And also, in addition to what I got paid to do on a volunteer basis, I was president of the medical staff at my health network, and then ended up being chairman of the board of JFK Health Network for 17 years. I then merged JFK into Hackensack Meridian Health, which is the biggest health network in New Jersey, and I'm on the executive committee of that board. I also was very active in oral surgery on a national level in the American Association of Oral and Maxillofacial Surgeons, and I chaired a bunch of committees. And I guess the point of all this is that I was very, very active for decades, and I really had no plans to retire. We loved what we did, and my wife and I planned to, at least I planned, to work in the office several days a week until I couldn't, and then to take a nice vacation every 3 months maybe, and just live life that way. We were always very active in the stuff we did. I owned an airplane at one time. We were scuba divers, we were skiers. We just did a whole bunch of stuff as a family with my son David, who you'll hear from later. Anyway, everything was wonderful until May of 2022 when I suddenly lost vision in my left eye. And after losing vision in my eye, I wasn't able to perform delicate surgery anymore because I had no depth perception and my vision just wasn't so hot. Then a crazy thing happened. A week later, I ended up perforating my colon. And is it related? We really don't know. I was on high doses of steroids in treating my eye. I was on a lot of prednisone, and maybe that had something to do with it. We really just don't know. But I developed some belly pain that wasn't horrible, and I was working through it. And but then I got a low grade fever. It was like 100.3, I think. And I spoke to David, and I remember in the morning, and what he said to me was, in my world, until proven otherwise, you may have a perforated colon. Get your butt to the hospital, get your butt to the emergency room. To which I said, I'm not going to emergency room, even if it's mine, because of what we know emergency rooms are like. So we arranged for a CT scan, and we did the CT scan, and the chief of radiology came out and said to me, Michael, I don't know how you're standing there. Let's get your rear end over to the ER. You've got a perforated colon. So I later that day, I ended up having surgery and ended up with my colostomy, which I, of course, hoped and envisioned that it would be temporary. But David began preparing me at that very point for the possibility that we should consider this permanent. He knew that I had several other medical issues that he felt made me a poor candidate for a reversal. And we just went into that surgery thinking that it may be permanent. But as things unfolded 6 months later, we decided to try a reversal anyway. Um, I'm told that what happened is David was up in Boston. We had excellent colorectal surgeons on our team at JFK. And I'm told that the surgeon spoke to David, described what he found during the surgery, and the two of them agreed that they should just stop trying. And I woke up with my colostomy. They did repair a hernia that had developed. So I came out of that operation with a repaired hernia, but I still had my colostomy. And now I turned into a patient who was just going to have a permanent colostomy. The the thing that limited my function more than the colostomy was my vision loss, because that prevented me from doing lots of stuff and really made it just difficult to read and all kinds of things. And the colostomy went along with it. But then what unfolded, and it's really crazy, I had some other medical issues that overrode everything. And I ended up with a horrible infection in my leg from classic flesh-eating bacteria. And I developed necrotizing fasciitis in my left leg. And I spent the next 4 weeks in the intensive care unit in my hospital. And then I was in the hospital for weeks and months. And the colostomy just became part of my medical history. What happened is because I was chairman of the board, you don't get paid to be chairman of the board, but you do get some special privileges. And what I got was my wife got to move in with me. So she was with me 24/7 for weeks and weeks and months. And what we would do is just tell the nurses, I have a colostomy. It was part of my history. I have a colostomy, but we have everything that we need to take care of it. You'll get us some supplies, and we are going to take care of the colostomy for you. And we did. And it just became part of my overall being. And then the necrotizing fasciitis occupied really weeks of time in the hospital. And we ended up coming very close to losing my life because I ended up septic. I had sepsis twice. And that's really crazy where I became unconscious at home. And they saved my life in the hospital. And we eventually saved my leg also. But the colostomy was just there as part of everything. So we now got out of the hospital, and the next thing that happened, the next thing that happened was we decided to address a back problem that I had because in recovering from my leg infection, I then needed to just get back in shape because I had been hospitalized for months. And now a pre-existing back problem was preventing me from really walking and just getting physically fit again. So we decided to do a back operation, and that didn't go very well either. I ended up with a fusion of L3, 4, and 5, which is a big deal. But then 6 weeks later, we realized that my bones were just not good enough to support the fusion, and we repeated the operation, and this time ended up with fusion of L3, 4, 5, S1, S2. Now that is a huge post-op, and I'm still recovering from that. Lots of pain medication is necessary, and lots of stuff goes into it. But all along, the colostomy, we just ended up making it part of me. And there's lots of adjustments that go along with having a colostomy, and Rolf knows about these things. So we used to be avid golfers, and now it's hard to plan 18 holes of golf because I don't know what's going to happen with my colostomy has a mind of its own. And I could sometimes go 2 days without producing anything through the colostomy. And then in an hour, I could fill 2 bags. So we just don't know. So maybe we don't plan 18 holes of golf anymore. And the other things that we need to do is I learned that I can't go to dinner and then go to a Broadway show because going to dinner might stimulate me producing. So there's things that we learn that we just don't do anymore. But there's other things that we need to learn how to deal with. Like, what if I need to go on a long flight? And for instance, I'm booked to speak in Seattle sometime in the future. And that's hours and hours of having to deal with the potential of the colostomy acting up and requiring attention. So you learn to deal with that. You learn to tell the flight attendant when you get on the airplane, I whisper in their ear, I say, listen, I don't think that we'll have a problem, but I have a colostomy and it's possible that I may need access to the restroom on short notice. And we've learned that I have an excuse to fly first class to make that possible all the time. And so that's not bad. I get to do that without a guilty conscience. And Ralph is laughing because he knows. And the flight attendants are incredibly, they're very accommodating. I found even the TSA people at the airport, when you tell them what's going on, they're very accommodating also. And they're very respectful of you when they do their inspections and et cetera, et cetera. So there's things that you learn that you just can't do, and there's other things that you learn how to do it. But I think that you can't define yourself as a colostomy patient. You have to define yourself as you normally would, and then you figure out how to live with this thing. And you definitely have to change things. It affects things a lot, but you can't let it stand in your way because otherwise your life is not being used to its fullest and you learn things to do. And I think this is a tremendous opportunity for me. I would love to get on board with Rolf as I continue recovering from my back. I would love to be able to help other patients. I would love to lead support groups and things like that because there's lots of things you learn and you can make life easier for people than it was for you as you had to teach yourself. So I've probably exceeded my 10 minutes here. I didn't think I'd be able to fill 10 minutes, but I'm sorry if I went over. And so I'll stop talking.
Dr. Kleiman, I got to jump in. Thank you. That was so inspiring. And you're right. You become very body centric, right? You get to know your body. You understand that when you eat, 30 minutes later, peristalsis is going to push out whatever is in your, sort of terminal ileum. So,
Yep.
you become very aware of all that. I'm going to take you up on your offer because we created something called Team Hope,
Mhm.
where we take veteran ostomates like yourself and we pair them with new ostomates who are going through this, who are requesting sort of a friend to help teach them tips and tricks and how do you do this? And we've got this very robust group of volunteers, veteran ostomates, who want to do that. We didn't have that when we were going through it, and it makes such a difference. The little things, just like you talked about, talking to the TSA agent, making sure you know where every restroom is before you
Mhm.
go, to the ball game. Um, all of
Yep.
those little things that you don't quite appreciate when you have normal bowel function, but when you have an ostomy, you're very aware of. So thank you
Yep.
for that. That was very inspiring.
I would love to help you out. One of the advantages of not being able to do surgery anymore is suddenly I have free time that I never had for the rest of my life.
Yeah.
So you can call me. You'll have my number.
We got it.
This
Thank
is
you,
why
sir.
we're here, to make these connections. Absolutely. And just so for those of you listening, Team Hope is one of the things that we are trying to put as a resource for patients in their post-operative smart sets, like in the electronic medical record, so that they will actually just have access to it if and when they're ready to look at it. Anyway, so this is my first time hearing Dr. Kleiman's story, so I am so honored, and thank you so much for sharing it. I just think that you had such a unique perspective in terms of having other medical issues along with the colostomy, and it almost made it that the colostomy was the least of your issues in the face of that. You mentioned several times that the ostomy was just part of your medical history, and but something that you learned to deal with. And I'm always just amazed at how humans have the amazing ability to adapt. And then as time goes on, we are just living with these conditions with grace and a little bit of humor. So first class travel is always a perk. I'm going to save the questions again for the end. And then last but not least, we have Dr. David Kleiman, who is Dr. Kleiman's son, the colorectal surgeon. I'm going to give him a brief intro and then task him with a short explanation of about the difference between an ileostomy, a terminal ileostomy, and a colostomy, because I think that is the difference between our two friends here. So, Dr. David Kleiman is a staff surgeon in the Division of Colon and Rectal Surgery at Lahey Hospital and Medical Center in Burlington, Massachusetts, and holds an academic appointment of Assistant Professor of Surgery at UMass School of Medicine. He completed his general surgery residency at New York Presbyterian Hospital, Weill Cornell Medical Center, and then a fellowship at the same place in colon and rectal surgery, both Cornell and Columbia campuses, and then also Memorial Sloan Kettering Cancer Center. Dr. Kleiman joined the staff of Lahey in 2017, where he currently serves as the chair of the Robotic Surgery Committee and is the program director of the National Accreditation Program for Rectal Cancer, NAPRC. He is an active member of the American Society of Colon and Rectal Surgeons, where he currently serves as the chair of the Young Surgeons Committee, as well as co-chair of the program committee for the 2027 annual scientific meeting. Dr. Kleiman is passionate about teaching advanced techniques in colorectal surgery and has led many hands-on courses and spoken nationally and internationally on advanced laparoscopic, robotic, and transanal surgical techniques. He lives outside of Boston with his wife and 2 sons. All right, you have got the floor. I'm going to mute my.
Well, thank you. Thank you so much, Carmen. And thank you to Rolf. And of course, thank you also to my dad for being here. It's great to be back with this group in collaboration for such an important topic for all of us. This is obviously a very special opportunity to speak on a panel alongside my dad, as the last several years have been quite tumultuous for our family, as you can imagine. But this really represents a junction of 2 of the most important things in my life, being my family and my profession. And never in a million years did I ever think that the 2 would become so intertwined in this way. So what I'd like to offer in the next few minutes is sort of my unique perspective as a colorectal surgeon watching something like this happen to such a close family member of mine, and how that perspective has really changed the way I communicate with my patients and how I help take care of my patients moving forward. I think when a lot of people hear that my father has a colostomy, especially when I tell my patients that, I think a lot of them assume that somehow inspired me to become a colorectal surgeon. Which sort of checks out. A lot of people, everyone has a story. It's an odd profession to choose, by choice. So a lot of people have some sort of a backstory as to what inspired them to become a colorectal surgeon. But what I then point out is that I've been in practice now for 8 years, and the emergency operation that led to the colostomy of my dad happened 3 years ago. So I was already a well-established colorectal surgeon when all of a sudden the idea of a colostomy became very personal and hit very, very close to home. That day that my dad described when the perforation occurred will be forever etched in my mind. It was a very, very surreal feeling to be sitting 200 miles away outside of Boston at work in a busy clinic and to receive these updates via text message from my mom as this was happening. I remember going between patients that day. I knew the CAT scan was going to happen, and my mom sent me a text message with 2 lines, a very simple text saying, the CAT scan shows that there's a hole in his colon. We're waiting to see a surgeon. And in that moment, 2 thoughts immediately popped into my head. The first is that he's going to need a Hartman procedure, which means resection of a portion of the colon with a colostomy. It was going to have to happen that day, and that the colostomy would wind up being permanent. We as doctors get asked about advice by our friends and our family all the time. And usually it's about things that we know very little about. It's about my friend's kids' rashes or some kind of thing that they heard on TV. Is that true? And I'm saying, I don't know. I don't know what that rash is. You could Google it better than I can. But every once in a while, something comes up that really hits closer to my wheelhouse, where I actually do know something about. And it doesn't get any more in my wheelhouse than talking about a colon perforation. And when you're a so-called expert in a particular subject matter, there's certain things that you know before anybody else. You have this sort of this foreshadowing or this clairvoyance when you know what's about to happen, because you've seen it so many times. You know what comes next. And for me, that's what happened. And interestingly, there was 2 phases. The first phase is when the thoughts popped into my head, and it was a very sterile thought. It was very clinical. It was the same thought that would have popped in my head if a resident called me and told me that there's a patient in the ER with this perforation. I'd say, okay, call the OR. We need to do a Hartman. There's not much discussion about that. And that's the way it happened first, where my first thought was a clinical thought. And then all of a sudden, this wave of ice came over me when I realized just what that means for my family and for him. And in that moment, I suddenly understood that 1,000-yard stare that I have seen from patients so many times when I sit down with them and tell them that the surgery they need is going to require an ostomy, and especially if I know that that ostomy is going to wind up being permanent. You hit the patient over the head with 1,000 pounds of bricks, and it is just devastating. And I never felt what that felt like from a patient's side until that very moment. The next thought that occurred to me is that I was going to have to explain this not just to my dad, but actually to my whole family, because they were all going to have a lot of questions about this. We have a very close extended family. And I then assumed the role of sort of interpreter for the rest of my family to try to explain why this was necessary. And then even harder, why this was going to be a permanent ostomy and why it was not reversible, which wound up being its own separate set of challenges to try to act as that intermediary. Since that time, over the last 3 years, I have learned a tremendous amount about what it means to live with an ostomy. I thought I knew before, but I really did not know. And now I have learned so much that I have tried to incorporate into my daily life and into my interactions with my patients. And there's a few takeaways that I think are salient to this group here. I like breaking big ideas down into 3. So 3 takeaways of things that I have learned most about this whole experience. The first is that having an ostomy is not easy. It is challenging. And as much as we try to adapt, as much as we try to increase awareness and increase acceptance of our ostomies, make no mistake, this is a very big deal. And I think we have made tremendous progress with increasing awareness and reducing the stigma associated with having an ostomy. But at the same time, there runs a risk of minimizing it or normalizing it. And I think some patients, in our good faith effort to try to help our patients cope, some patients feel like we're minimizing it. And I think we have to be careful about that. It's hard. There's going to be challenges. There are going to be failures. Pouches fail. Leaks happen. There are blowouts. There are separations. There are all kinds of things that are going to occur. And the patients are not doing it wrong. And that is okay. And I think that's probably one of the biggest things that I now empathize with more than I ever did before. The second is that we as surgeons really don't have anywhere near the amount of time to dedicate to our patients to really understand what's going on in their lives. My little 15-minute follow-up visits that I have with my patients to do their yearly stoma check-ins, we are just scratching the surface with what's really going on in their lives. And I have this image in my head of sort of being like the dentist that comes in at the end of your teeth cleaning. You know, you spend 45 minutes with the hygienist, and then the dentist pops in and says, "Hey, how you doing? Okay, no cavities. We'll see you in 6 months." And that's the way I feel sometimes as a colorectal surgeon popping in after the WOCN visit. Um, the patients smile, they say they're doing great, but there's so much there that is not being said. And sometimes just acknowledging that gap exists is enough for the patients to feel heard and understood. And I might not be able to sit down for an hour and talk to every patient, but at least I know what's going on, and can screen for when there's really trouble that needs to be addressed. And finally, there's the concept of two things are true. So my wife and I say two things are true a lot to our kids. That's one of the coping things that we're trying to instill in them. That two things can be true. Yes, your brother took your toy, but no, you cannot punch him. So two things are true when it comes to ostomies. You can hold two truths at the same time. You can be very grateful to be alive, and you can be very grateful to have regained your health. And you can also be sad that your life now looks this way. You can be very grateful to the care team that got you through this life-threatening situation. And you can also question whether that was the right choice, or whether that had to happen, or whether something could have been done differently to avoid an ostomy. You can hold these conflicting feelings at the same time, and that is okay. And I think, again, when we push acceptance so much, I think we also have to recognize that those feelings are natural and they are going to be there as well. And everybody sort of internalizes them and processes them in their own way. And I think those are three things that I think have enriched my practice more than any other. And I think about those every week when I'm talking to my own patients with ostomies or counseling them before surgery. And life throws many different curveballs at you. You never know. You never see something like this coming. But what you can do is learn from it and hopefully grow from it, as Rolf explained so beautifully in his story, and as my dad explained in his, and as hopefully I'm doing in my career as well. So with that, I want to thank you again, Carmen, Rolf, and everyone else involved with bringing attention to this. And thank you for this opportunity.
Oh, David, I got to jump in. That was so good, so appropriate. It reminds me, I've been living with an ostomy for a lot of years, and it's become accepted. So I have a different perspective. Your dad's still going through it. That transition is tough, there's no doubt, which is why we created Embracing Ostomy Life. This is a foundation I started with the help of some really good friends to address that really critical first 30 days. You surgeons are so good now. You do the surgery and the patient has barely cleared their anesthetic and they're out the door. I mean,
Yep.
you do it laparoscopically. You literally have maybe a visit with an ostomy nurse. You cannot remember a thing and then you're out. And that first
Yep.
28, 30 days, you are completely overwhelmed. Completely. You have no idea where to start, what all the little secrets are that you're going to learn over time. So we actually built a program that virtually holds the hand of the patient during that really difficult transition. They get an email from me, which is a sort of an inspirational message, and we get tips and tricks from nurses and doctors, other patients, a full set of resources for them, sort of the right information at the right time for 28, 30 days. And it is so critical because 30% of ileostomates end up back in the hospital for things that are completely preventable, but they don't know. For example, when you lose your colon, you can get dehydrated like that. You don't realize you have to drink more. And the next thing you know, you're in the ER, you need 2 bags of fluid. Totally avoidable. So what you talked about is so, so true. And you're right, we can never minimize the change this requires in a person's life. I will say now, looking back, I shake my head at all those difficult first time things, like the first time I had to take a shower with my teammates. It's like you are exposed. This is like, are people going to ridicule you? Are they going to avoid you. Actually, what I learned, no, they respect you more. They see what you've gone through, what it's taken to get back your life. And in their own sort of inimitable way, these big behemoth guys came around me and protected me. I'll get emotional talking about how I misinterpreted how people would take this. So I just appreciate your discussion there, your dad's. This is really important for people to hear. Thank you.
Thank you, Rolf. Appreciate that.
No, thank you so much, Dr. Kleiman, for sharing that part of your story and for like those very important insights as both a colorectal surgeon and a caregiver. I think holding space for that dichotomy is so important. You know, just remembering that both things can be true. I had a bunch of questions, but honestly, I want to see if you guys have any questions for each other first, and then I have a couple just to throw out to the panel.
Ca- Carmen, I just want to make a comment.
Yeah.
that I'm incredibly proud of both of my sons, and I'm sitting here crying when I'm looking at David. I was so lucky to have him to support me, and still lucky to answer my questions that may not have been answered by my team here. And I feel so bad for him that he had to go through everything he went through in helping to care for me. So I'm just so grateful, and I'm uniquely lucky to have it. And I have to say, I'm proud of both my sons, but poor David got stuck with this one.
You know, Dr. Kleiman, I'm going to jump in and then I want your son to respond. I watched my dad, who was also a physician, brilliant scientist, unable to help me. He watched me like you in the hospital, unable to help me, not like your son, and it killed him. It killed him. And ultimately, it became an extraordinary way for us to connect because he saw, how hard I worked to get back to play again. And then I got to play again and was sort of given the opportunity to deflect attention on me as an athlete to the plight of these patients. And I'll get emotional because he became extraordinarily proud of me for doing that. And it changed our relationship the rest of our lives. He passed away 8 years ago. He's 104. He was 94. He passed away. It changed our relationship. And I wouldn't trade it for how connected we became. And I think he wouldn't either. So you made me emotional thinking about that. There are blessings that come in the rarest and oddest ways, I guess.
Yeah, it's certainly been a unique opportunity to be able to help someone so close to you in such an important way. I consider it a blessing. I mean, we are, all of us in this profession. It's more than a job. It's a calling. We all do this because at the end of the day, we are just so incredibly passionate about helping patients, helping other people, um, and to be able to apply some of that knowledge and experience to help your own family. I mean, if we can't help our own family, what I mean, that's the ultimate gift, to be able to do that. And so it's not been easy, but it has. I to echo Rolf what you said. I mean, it is something that ultimately we're very, very grateful to be able to do. We can't control what happens in life, but you can control how you react to it and what happens next.
I'm going to throw three general questions out there. So one is, and actually, so Patty is going to ask a fourth one. What advice would you each give to someone facing ostomy surgery? So very important. My second question is, how has having an ostomy changed your relationship with your friends and family? And then the third question is, were there any unexpected emotions after finding out that you had an ostomy, or in your lifetime, or finding out that a family member had to have an ostomy? And then specifically for Dave, did you want to go in and do the surgery yourself? Because I can tell you what my answer would have been. All right, anybody can tackle any one of those questions.
So I'll take the low-hanging fruit of that last one first. So here's an interesting tidbit. My dad removed every one of my wisdom teeth, removed every one of my brother's wisdom teeth, removed he did more than just that on me. You've done what, six different, I don't know. He pulled all my baby teeth. I had one tooth that needed to be uprooted that came in crooked. He did all of those surgeries himself. He wouldn't let anyone else touch my mouth. Major abdominal surgery is a little different. um I you know, I had a lot of faith in his surgeons. Um, and believe me, I thought about this ahead of time. The first one was an emergency, and I'll share because she would be happy to do it. It was Marie Audette, who Carmen and I probably know from ASCRS. She has since moved from New Jersey up to my neck of the woods in Maine. She's at Maine Medical Center. She's become a very good friend. We didn't choose her that day. It was an emergency. She was on call. She got stuck with us. But she did an amazing job, and you better believe when I saw him for the first time after surgery, the first thing I did was lift up the gown and look at the colostomy. So, and I must say, she made a perfect, beautiful colostomy. Because we all know that cuteness and beauty counts when you're making a stoma. It's an art. And she made a perfect stoma. So we were very, very lucky. And for the reversal was different. She had moved to Maine, so we established care with a different surgeon within the group who we have tremendous amount of confidence in. I don't think I would have done that surgery, but I would have wanted to. But I think doing major abdominal surgery is different than teeth. Sorry, Dad, not to not to minimize oral surgery, but it's a little different.
Well, you have to remember that I did put you to sleep and you woke up alive. So,
True. True.
right.
Yeah.
No, thanks for that. Like, I agree. I would have probably wanted to, maybe I would have just wanted to stand in the room and make sure everything was being done right. But again, we trust our colleagues to do the right
Yeah.
thing. We're all trained professionals, and absolutely, having that continuity of care, in your neck of the woods is going to be important rather than someone jumping in and out. But what a unique perspective. All right. Any of the other questions that we want to tackle? We have probably like 5 to 8 minutes left. I think, maybe one of the more important ones is what Patty said. What advice would you give to someone facing ostomy surgery? Or what would you even tell your younger self, or your younger self of like 3 or 4 years ago?
Well, I'll start with that. I guess because I have more experience, more wisdom, more years under my belt. So a letter back to my younger self is part of the theme, I think, of what I've learned in my life. There've probably been 4 or 5 devastating things in my life where I would have literally I'd have sold my soul to not have to go through that. Not quite so devastating when my dad moved us to Southern California. Turned out to be an incredible blessing. Was the only reason I got into football. But my illness was one of those. It was so painful. It was almost 2 years of being sick. It was in the middle of the beginning of my football career where there was nothing but good things ahead. This wasn't anything I did to myself. My body, which had always been there, just now was doing something. I had this disease. It wasn't fair. I was angry. Why me? This isn't. And I would have done that Faustian deal then. Now, fortunately, you can't, and instead you get to go through it and come out the other end, and you learn all these truths about life, about yourself that I wouldn't trade. But at the time, I would have, and I've had several subsequently. I needed 80 units of blood. I ended up getting hepatitis C. I didn't find out until I was married, and we had 4 kids, and I went for a routine insurance and physical, and the doctor called me and he said, "We need to talk. What do you have? You have Hep C." I go, "My God, it's Hep C. Am I going to die? I got 4 kids, 3 with special needs. Is my wife going to be a witness?" So I ended up getting on clinical trials, the early clinical trials, and got cured of Hep C. Again, a devastating thing that turned into a blessing. So what I would tell my younger self is, as Dr. Kleiman said, David, it's hard. It's hard. You're going to have to face things that are really difficult. How do you tell a friend? How do you tell a girl you're dating? How do you tell your future wife? How do you tell your teammates? What clothes do you wear? How do you figure out how to go to a football game as a fan when you know there's a long line in the bathroom? How do you travel and you have to go and there's a line or the seatbelt lights on, you can't get up and go to. So all of these things you're going to have to figure out. And at first it's why this isn't fair, none. And what my wisdom will tell a younger person is that's the wrong question. It's not why me, it's what's now. What now? Where is this going to lead me? And in my case, it led me to a life of getting a chance to meet extraordinary people like David and Michael, and learning their stories and seeing their courage and their tenderness and the way they've changed and the way they appreciate life. And so I would say, yes, it's hard. David, you made it really clear. You know, we can't minimize that transition. And I'm going to say, there'll come a point in your life where you'll be grateful for things you can't understand now. And I will say, we're very fortunate to live in a time where we have great products. People are talking about it, their stories. We can make that transition from why me to what now much quicker. We have learned the power of hope, and the power of hope really comes from other stories. People who are willing to share that, yes, it was hard, but look where I am now. And you can do the same. So we're very fortunate, I think, in that regard.
Thank you so much. Any final thoughts before we wrap up? I don't want to keep you all too long.
I think that if I were to say advice I would give someone facing ostomy surgery, you know, for me as a surgeon, I think it's our job to really talk through options, because there's usually not only one option. There's very often, more commonly, there's a couple of different options available to a patient. Every situation is different, but there's oftentimes choices that can be made and risks that need to be considered when talking through. And I think of the perspective that surgeons can sometimes offer, and some patients who went through this, is that there are certainly worse outcomes in life than having an ostomy. And this is a big part of the conversations that we had when talking about the possibility of reversal surgery. People sometimes have no idea how bad things can get when they suffer consequences of chronic leaks or horrible function or any of a number of other complications that can occur. People think that it's you know, oh, I'm a gambler, you know, let's take the chance, I got to give it a shot, but they don't fully understand what can happen. And I think a lot of people who might listen to this may have gone through some of those complications, and know a little bit about what I'm referring to. So really take time to ask your care team about what could happen in the alternative scenarios, and that can sometimes help add perspective and realize that winding up with a permanent stoma is sometimes really a pretty favorable choice.
Well, thank you all so much for doing this. And I just, you know, having listened to your stories, I think I'm probably going to be a better person and a better caregiver and a better surgeon after this as well. And if there's any other final thoughts or any other questions, I will make sure that we have them answered, you know, once we actually post this video. But otherwise, check out Embracing Ostomy Life, Team Hope, and the Grateful Patient Project, right, Rolf? On your website.
Yeah.
Yeah, or his
Thank
book.
you. Thanks. Well, thanks for having us on, Carmen, and great to see you, David, again, and Dr. Kleiman. It's a privilege, really. Your stories are inspiring, and we need to keep demystifying and destigmatizing this surgery that really is life-giving. Yeah, thank you.
Likewise, great to see you, Rolf, Carmen, and of course my dad and everyone else who helped make this happen. Thank you for the invitation.
Thank you so much. I'm going to